Our Ministry of Health has intensified measures aimed at increasing COVID-19 vaccinations countrywide. The current vaccination status shows that 58 districts, including the capital city Kampala, have full vaccination coverage of up to 49% respectively. Now, this was revealed by the Director Public Services at the Ministry of Health, Dr. Daniel Chabayinze, at a capacity building training organized by HEPS Uganda and partners at Imperial Royal Hotel here in Kampala.
Synopsis of COVID-19's current national vaccination status of May 2022, the Director Public Service at the Ministry of Health, Dr. Daniel Chabayinze, observed total progress of the virus vaccinations countrywide. According to Ministry of Health, 49% of the population has been fully vaccinated, translating the figure into over 10 million people out of the 22 million targeted people.
Our call now is to work with the media and civil society to increase demand generation and people to have perception that the disease is with us and the best time to protect ourselves is when the disease or we are out of a major crisis.
The Ministry of Health has also intensified strategies to increase vaccination coverage, especially to school-going children.
We are going to do massive vaccination, but we are going to use the schools as our focal point. So the secondary schools will be the focal point, and the proportion of people who are in that age category who are not in school, that category we estimate 6.6 million people to be vaccinated who are between age 17 and 12.
This was at a media capacity building convention on COVID-19 vaccination in Uganda by HEPS Uganda with the Consortium of Global Health Collaborative and partners held at Kampala Imperial Royal Hotel. The Executive Director HEPS Uganda, Kenneth Muhonge, expounds the narrative of Vaccine Advocacy Accelerator in relation to the COVID-19 pandemic and media.
This program is there to support government to ensure full vaccination, right from production, advocating for those TRIPS waivers to increase production through generic production. The supply chain, he has told you of the challenges they face once they take out these medicines from the cold chain or these vaccines. They require to be consumed within 30 days. So that calls for a very explicit and well-coordinated mobilization and supply chain.
At the training, media tasked Ministry of Health to show transparency and accountability in the entire COVID-19 vaccination campaigns.
I think that the Ministry of Health has an obligation to account to the citizens where the money that were given to them, what did it do? So issues of accountability are part of the story. There has been a lack of transparency and openness about expenditures during pandemics, during emergencies. Do we know, for example, the cars that were donated to government of Uganda during the COVID-19 pandemic, what they are doing, where are they now? Can we have a full accountability of the money that people individually got from their pockets to give to government? Where is that money? So whilst we appreciate that the government is in the effort of saving lives through vaccinations, we need to pay clear attention to accountability.
Out of the 44 million COVID-19 vaccines in circulation, government has procured only 3.5 million doses of vaccines, which means that 40.5 million doses are donations from partners and developed countries.